Hi.
Hi.
Ew, I don't know how to turn off my film. Oh, here we go. It's good to see you.
Well, it's good to see you. I've really looked forward to our first get together.
Hey, I'm with Jan Marini. So, the founder of Jan Marini Research. Not only have you been recognized and endorsed by the medical community, also recognized by New Beauty Magazine as being one of the top 20 innovators. So, having multiple patents, the list goes on, and I just feel so honored to be able to
Oh,
sit down today.
that is so kind of you. Thank you so much.
Thank you. But I know before we spoke, I said I wanted to talk like all things acne
Mhm.
with you. The reason is I had struggled with acne for such a long time, and that's like probably 80% of my clientele today. So to get to sit down, speak with you, I know that you've said in the past, acne is an epidemic today. So could you speak to that a little bit?
Absolutely. And everyone watching, I love to get questions. Please ask questions. So, acne really is an epidemic, and it's among adult females in their 20s, 30s, 40s, 50s, and beyond. Now, here's the reason I didn't say men. Men typically don't have acne past the age of 23. That's when they get terminal beard growth. Their beard reaches its full diameter, pushes everything out of the follicle. Think about your husbands or significant others or boyfriends, and they don't have the same acne that we have. Now, there are some exotic forms of acne that can persist into adulthood for men, but it's much less frequent. So here we are. You could be, again, in your 20s, 30s, 40s, 50s, and beyond, and you can have acne. It's an epidemic. And the average onset of acne, we used to think, okay, well, when do you get acne? Maybe you're 12 years old or 13 years old. But the average onset today is from anywhere from 12 years old, so it can be younger, to 35 years old. So imagine you've never had acne in your entire life and you get acne when you're 35. And it can actually, the onset could be beyond that. And it really affects an individual's self image, their self esteem, the options for adult females are limited. You walk into the drugstore, you can see an entire aisle of acne products, but they're typically teenage acne products. Now, it doesn't mean that it's not sometimes somewhat effective for teenagers, but it has an effect on adult skin where it can be very drying. Or it makes, not only do you have acne, but now your skin looks red and inflamed, and it looks worse than ever when you try to cover it up. And so we really need options, and options that cover a number of different concerns. If you have acne as an adult, chances are you still have concerns maybe about lines and wrinkles or texture, or you have concerns about brown discoloration. You can have rosacea and you can have acne at the same time. But we can actually de-age the appearance of skin, I mean significantly, and we can address acne at the same time. Now, one other thing I want to mention, because you mentioned that you struggled with acne. Well, I was in the 1 to 2 percentile as a teenager. I never had acne. I never broke out. A lot of times people will say, oh, I don't have acne. I just break out once in a while. Well, it doesn't matter if you break out once a year or once a day or 10 times a day. It's all acne. It's the same process. I never broke out. And then when I was around 19, I developed severe cystic acne. Eventually, I became a 2-time Accutane failure. And I'm a very big believer in Accutane, but it's not a cure. It puts people in remission. But my point is this: I never break out. You don't see my pores. You,
Beautiful.
my staff has never seen me with a breakout. But if I didn't do what I do every single day, I would break out. If I miss a day, it would maybe take a couple of days or 3 days, but I guarantee you, I would start having problems. So, what we're going to talk about today is how you can manage it, how you can get complete total clearing.
I'm so excited. I know your skin looks fantastic.
Well,
And
thank you.
yeah, I since using Jan Marini Skin Research, I never get a breakout, and I swear my skin just gets better every single day. But that's what you said, like you have to do it daily.
Mm-hmm.
So what you were talking about, like with acne, could you kind of explain the acne process to us?
Yeah, I think it's really important to kind of paint a picture. So if you can visualize the acne process, then you really start to understand what you need to do. And again, it's a term, acne is a term that's used to describe or identify a process. So it doesn't matter if you break out just occasionally, it's still acne. Also, clogged pores, blackheads are a mild form of acne. They're still acne, they're just very mild. Um, you know, we we talk about whether or not acne is hereditary. Now, they haven't discovered the acne gene, but it probably is hereditary, because if mom and dad had acne and the kids have acne, you're probably going to have acne. However, you could be the only person in your family with it, or the only person in your family without it. And nobody wants to hear this. There is no cure for acne. Again, Accutane puts people in remission. Remission, you could be completely clear when you go off of Accutane. You could be completely clear for 6 months. In general, they talk about how you're able to limit the disease. So you probably have seen people that have been on Accutane once or more, and maybe their acne isn't as bad, but they still break out, right?
Absolutely. They'll go for a bit and then some
Yeah.
people it'll formulate again. So I know it's very frustrating for them.
And
But
it's rare that you're going to see somebody that went on Accutane. I mean, really rare. Usually more common in men that just go on Accutane and that's it. They never break out again. Um, it's a very, it's complex, it's multifaceted, it's a challenging disease. It's also an inflammatory process. Okay, so here goes. When you look in the mirror and you're looking at the surface of your skin, that's a stratum corneum. It's a dead layer. And you shed about 500 million dead cells a day all over your body. You're just not aware of it. They're microscopic cells. Now, you look at a follicle opening, and we oftentimes refer to them as pores, but they're really sebaceous follicles. So you're looking at an opening, and it is an opening into it's about as big around as the diameter of a hair. So it's this long, hollow tube. Now, at the bottom of the tube, you've got sebaceous glands that produce oil. And inside the tube, it's lined with dead cells, very much like on the outside of your skin. So you're constantly shedding these dead cells into the follicle. And one of the reasons you produce oil is not because it's going to keep you young forever, because the oil pushes the cells to the surface, they sit there and they fall off. Now that's what's supposed to happen. But in individuals that have acne, we don't really understand why. The cells stick together. So they form initially what's called a microcomedone. Now you could have perfect skin, and you could have lots and lots of microcomedones, and they can sit there and they can be dormant for an extended period of time. You could break out within a matter of days, or it could take months. Sometimes people have microcomedones for years. Here's a good example. So you're 8 years old. The age that at which women enter puberty is measured by breast development, not menstruation. So if you've got little budding breasts, you're in puberty. Now, you might have perfect skin when you're 9 and 10 and 11, and then all of a sudden, one day, you wake up and you're 12 years old and you're breaking out. Probably had microcomedones all the way back that many years ago. And so there can be this sort of a lag time, and sometimes people think that their acne is cured because they don't break out for a while. Suddenly they're breaking out because, again, they have these microcomedones. So there is no cure for acne. Now, here's how acne progresses. So the microcomedone, this little clump of dead cells, is microscopic. As it progresses, it can go a number of different directions. So the cells can keep sticking together, and eventually the follicle dilates. And you see that as a clogged pore, a blackhead, open comedone, and you can squeeze them and you can get something out of the opening. But what you've done is you have simply removed something out of the opening. You've done nothing to stop that process. It just moves itself right back up again. Now, when it becomes more serious, is sometimes we don't necessarily see a pore opening. We might feel a bump, or we feel like something is happening under the skin. And inside the follicle, when the cells continue to stick together and stick together, they begin to trap oil and they trap C. acne bacteria. Now, C. acne bacteria is harmless. You can't catch it. You can't spread it. It's not contagious, but it's part of your body. But when it's trapped in the follicle with the dead cells and the oil, it eats the oil and it excretes a fatty acid byproduct. Now, that fatty acid byproduct is really corrosive. So what it does is it wears your follicles down. So your follicle is getting a lot of stress on it, dead cells, bacteria, oil. It's kind of getting inside there. It's starting to look like a little balloon. And what happens is it may eventually leak, rupture, or blow out. Now, if you get a leak, it's near the top of the follicle. So some of the dead cells and the oil, they kind of get pushed out, leak out. And as it makes its way to the surface, it's an inflammatory process. But because it's kind of near the top of the follicle, it's going to be not a really dramatically aggressive lesion. So it could be like a red bump, a papule, or a pustule. They typically don't hang around too long, although if you have a whole face full of them, that's not a good thing. Now, if you have, it's called a rupture, that's more in the middle of the follicle. So the follicle opens up and it's deeper, more material goes outside. As it makes its way to the surface, you're going to end up with a nodule or a mini cyst. Now, that's really common for adult females. And where do they get them typically? You can get them anywhere.
All in this, yep, down
Exactly.
here.
Exactly. Now, if you have a blowout, so it looks like the entire side of the follicle just blew up and a lot of material goes outside, you're going to end up with a cyst, an actual full-blown cyst. Now, the reason why cysts scar, and I want to qualify scarring, a lot of people say, oh, I've got acne scars, but they have discoloration. A scar is an injury to the dermis. So you've got something where the dermis is compromised. There's a divot. There's tissue that has been compromised. There's an indentation. There's an ice pick scar, something like that. And when that material goes outside, when it's going to be a full-blown cyst and it's like the side of the follicle blew up, what happens is the inflammation gets down into the dermis. And that's why you almost always, virtually, you're going to end up with scarring, actual scarring with a cyst. Now, you can get some scarring with a nodule or a mini cyst. Not quite as likely, but there's things that we can do. We can talk about that we can do for that and for the leftover discoloration. So that's kind of the process. That's what happens and how you get an acne lesion and the type of lesion that you're most likely to get.
Yeah, I love that. I think what people don't realize is there's so many different levels and there's different types as well. So whenever you go into like treating it, there is not just one thing that's going to treat every type of an acne lesion. And I love the way you break it down and it helped me understand in my practice as well. Like it is a process, and even if you have just one, you still have acne. And I think also what you spoke about, which I'm curious about, you were saying how long can it take for an acne lesion to kind of form? I've heard quite a few different numbers, but I'd love to get your take on it.
Yeah, it just depends because again, somebody could have microcomedones and they can just be dormant for whatever reason. And then all of a sudden you get pregnant or your hormones kind of change or you're using something that aggravates or triggers maybe something that is comedogenic. And diet can play a big role as well. We'll talk more about that because there's certain things that can really have a trigger on acne. But in some individuals, it can take a while for it to progress. In other individuals, it can be pretty rapid.
No, absolutely. I love talking about the diet because that's a huge portion of it as well. I hear a lot like dairy is the biggest one.
It is. And I definitely want to get to that. And I want to tell people, okay, so first of all, what is the solution? Because we talk about, that you can get complete total clearing and you can manage it so you don't have to break out. But I'm sure everybody's wondering, well, what is that? And I always say, you can do anything you want to treat your acne. And I deal with people all the time that have gone on for years with their acne just going up and down and never really getting control over it, but spending huge amounts of money. So what I'm going to tell you, there's really no negotiation. There's no exceptions. This is what you've got to do. And there's two different pieces that we're going to talk about. So the first one is the skincare management system. Okay, skincare management. Now, that's the starting point for everyone. So I could be talking with a world famous physician. I could be talking with an A-list celebrity, anyone I'm talking to, and it doesn't matter what their concern is, whether it's acne or aging or discoloration, whatever it is, it's going to start with skincare management. This is critical. And the question always becomes, well, how can we all be on the same system and have different concerns? Maybe mine is that I have lines and wrinkles, and yours is that you have acne. So I'm going to give you an example of one product in the system that has the ability to address a lot of concerns, and that's BioClear. I know you,
Love it.
I'm sure you love BioClear. Now, BioClear is glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for acne. It's sold by prescription for rosacea. It's one of the best resurfacing agents we've seen for the appearance of fine lines and wrinkles. And it's a pigment lifting agent. And then we have glycolic acid. Now, glycolic acid, I could spend hours talking about it, but at the very simplest level, what it does is it dissolves and dislodges the glue-like substance or cellular cement between cells, cause them to lift apart. Now, it does that on the surface of the skin. So it makes your skin look so much smoother and glowing and radiant. It makes it look so much younger because it completely reorganizes the epidermis. And it thins and compacts the stratum corneum. So you want a really thin, compact stratum corneum like baby skin, but you want a thick dermis. And glycolic acid, it does this very rapidly. I'm sure you've heard your patients say, is it my imagination? But the first day or two, I really notice a big difference. And you do. You notice a big difference in the texture of your skin. Now, it has this tiny molecular weight. So it's so much, most things don't get into your follicle. That's a fallacy. But glycolic acid has such a tiny molecule, it gets into your follicle. It's so tiny that there are some prescription topicals where glycolic acid is used as a delivery agent. It's the smallest of any alpha hydroxy acid. It goes into your follicle, and what does it do when it's in there? It dissolves and dislodges the glue-like substance or cellular cement between cells, interrupts the acne process. Now, also, it's a very powerful anti-inflammatory, and it can thicken your dermis up to 33%. That's roughly how it works. Now, we're going to talk about things that go way beyond that, but the more you thicken your dermis, the younger you look, the healthier your skin looks, the tighter it looks, and it also decreases the appearance of acne scarring because as you thicken the dermis, it fills in some of those, it helps to fill in, it stimulates collagen to fill in those spots where you have depressions and things like that. It's actually categorized chemically as a moisturizer because glycolic acid stimulates the substances you have in your skin between your cells that make your skin nice and plump, helps with barrier function. Those are mucopolysaccharides, ceramides, phospholipids, and hyaluronic acid. Okay, so that's number one. Now, there's a lot of other technology in the system for addressing aging and also helping with acne. So it's packed with lots and lots of technology. But the second part of this is duality. Okay.
So good.
Now, somebody actually mentioned, I was going to say something, I thought somebody mentioned, what retinol do they need? Okay. So duality is a dual chamber product, and we are going to talk about retinoids. So it actually has two dispensers at the top. You push down on one, push down on the other, and then mix it together in your hand. I'm going to tell you what dispenser number one is, chamber number one. It's benzoyl peroxide. I know what everybody's thinking, Jan, benzoyl peroxide. It's a teenage medication. It's going to dry my skin out. This is different. It doesn't dry. It's a different benzoyl peroxide. It works faster, doesn't dry the skin, and it we had this tested. This was tested by Dr. Jaggi Rao, who's a board certified derm in the US and Canada. He's the head of the dermatology residency program at University of Alberta, and he's the CEO and founder of the Acne Clinics of Canada. And we did this test in 120-degree below zero weather. The patients in the study using this benzoyl peroxide, their skin was more hydrated after the study than before the study. Now, here's how benzoyl peroxide works. Benzoyl forces peroxide in the follicle where it releases oxygen. C. acne bacteria can't live in oxygen. It kills it better than anything we've ever seen. That's a statement by the American Academy of Dermatology. And you cannot kill C. acne bacteria for good. You can't just say, okay, I'm going to kill it. It's not going to be in my body anymore. It doesn't work that way. What you do is, it's called, instead of bactericidal, it's called bacteriostatic. You kill it every day because it's going to be back. That's why I said, if I don't do this every day, I'm going to have a problem. So once a day, you kill all the colonies, go away, and you don't, and instead of coming back, we keep killing it every single day. And so that bacteria can't eat the oil, can't excrete the fatty acid byproduct. So we have something that's going to go after the cells sticking together, go after the C. acne bacteria. So this is critical. And I mean, over the years, Accutane failures, I've not come across in acne that with some configuration of this, we aren't able to get clearing. Now, the second chamber is a retinoid. Now, to answer this person's question, we make retinoids in different forms. So there's the retinoid in duality, which is going to acne and aging. There's a retinoid in luminant, which would be if you have brown discoloration or if you have what's called dyschromia, which is just everybody's going to have by the age of 35. That has a retinoid and all the things for the pigmentation. And we also have just a retinoid on its own. So it would depend. This is why you want to get in touch with Olivia, because she can quickly determine which one you need or which one you should be using. Okay, so why is a retinoid so important? The retinoid is a gold standard for acne. It's a gold standard for rosacea. It's a gold standard for aging. It's a gold standard for discoloration. And I want to talk just a moment about the acne aspect of it and the aging aspect of it, because this is really important. So bear with me on this one. So with acne, it works differently than glycolic, but it changes the environment in the follicle. And we don't understand exactly how retinoid works on acne, but we know that it can have a really terrific effect. But in addition, there's nothing like a retinoid in the world for the appearance of aging. I don't care what anybody tells you. I don't care if they say, oh, this botanical bucotinol, whatever. You have retinoid receptor sites in your skin, alpha, beta, gamma. And when you use the right retinoid, I'm talking about a drugstore, walking into the department store, you're going to connect with those receptor sites. It changes gene expression. Now, what do I mean by that? So I'm sure everybody is familiar with being told, well, most of what you look at in terms of aging, you look in the mirror and you start to see changes, 90 to 95% is sun damage. It takes 10, 20, 30 years to show up. Most of it happened before the age of 10. What does that really mean? Well, your genes are made up of DNA. Some of your genes are expressive genes. So they express out information. It's a blueprint. It's the only thing your body looks at. So everything that you do, you blink your eyes, you talk, or to repair a broken bone, you're sick. Everything is based on those instructions. That's what your body looks at. Those instructions have everything that's ever happened to you, everything you've been exposed to in them. When you're born, your epigenome, those instructions are perfect. You haven't been exposed to anything yet. But you're exposed, you're in what's called an anabolic state, and you're growing and you're changing and you're developing just every moment. And in that anabolic state, even though you're coming in contact with everything that we come in contact with all the time, your body has the ability to ignore it. So you're not like getting lines and wrinkles, and you're not getting opportunistic diseases and things that generally don't affect babies. They affect adults, or they don't affect children. But everything you've ever done, every bit of sun exposure, if you ate crayons in kindergarten, it's all programmed into your DNA. It's in there. So you're growing and you're developing. Maybe you've had a huge amount of sun damage, but you know, Olivia, nobody comes into you at 15 years old and says, Olivia, oh my gosh, mom put me out by the pool all the time and look at me, I have lines and wrinkles and brown spots.
No.
So
Yeah.
your body kind of, it ignores it. Now, when you hit around the age of 20, you're fully cooked. You're in a catabolic state. And that's a state where you start to decline. So think about this. You have a laptop, you open it every day, it works perfectly. One day you open it up, the software is corrupt. You don't know why, but it's not working the same way. Well, it's kind of like your software gets corrupt. Those instructions suddenly show up, those corrupt instructions, and your body's going, and it's not quite repairing the same way. It's a slow process. That's what happens internally and externally. So the right retinoid, what it does is, this is 50 years of medical research or more. It's a fact. The right retinoids correct instructions coming from your DNA. So I use this analogy all the time. Two twin girls are each on the same skincare program. One uses a retinoid, one doesn't. And the one that's using the retinoid in 10 years will look 10 or 20 years younger than her sister.
Yeah, that's incredible. And I saw someone make a comment like the key word is the right retinoid. Like just you go to the store, get a retinoid, and someone wanted just to explain the right retinoid. So
And that's a great question. I will. And one other thing I want to mention first is I want to mention that the retinoid can thicken the dermis up to twice as much. And a recent study showed 1 year of use, 80%. Do you know what that does for acne scarring? You know what that does for lines and wrinkles? Textural, pore size. So it's really extraordinary. Okay, right retinoid. Let me explain this. Dr. Kligman, who has been dead a number of years, was the most famous derm in the world, and he invented retinoic acid or tretinoin, which is what we see in prescription products. He was with the University of Pennsylvania. He was an inventor. He invented many, many, many skincare type products and things like that. But he was very, very famous. And Dr. Kligman said for many years that retinol was actually more bioavailable. He wrote about this in medical journals. He said it would actually work better. So why didn't he take that forward? Why did he go with retinoic acid? Well, the reason is because the way that retinol works is when you touch it on your skin, everybody has an enzyme, and that enzyme converts it into the same exact active in the prescription. Now, when you do a conversion, you lose something. So typically, sometimes you have to use twice as much, or 3 times as much, 5 times as much to get to the same endpoint because you lose something in the conversion. In this case, with retinol converting into retinoic acid to get to be equal or greater, it's 10 to 1. Now, again, you might say, well, why didn't Dr. Kligman just, it's not rocket science. He makes something 10 times stronger, and he says, this is retinol, it works better, we'll use that. Well, the problem is that when you do that conversion 10 times stronger, if you have ever used a prescription retinoid and you had difficulty tolerating it, this is 100 times worse. I used to joke that it could take paint off your walls. It's really, really difficult to use. So you see very tiny little amounts of retinol when you go into a drugstore, department store. They're not going to have the liability that you're going to burn your face off or something like that. And lots of times, even with department stores, you can pay huge amounts of money. There's a product in a department store that sells a very modest retinoid for like $300. So our claim to fame is that we've been able to take retinol. We've been able to do that 10 times difference. We've been able to actually take it beyond the prescription. And
Wow.
in 78% of patients, there are no side effects. There's no acclimation. Not even what you would get with the weakest prescription retinoid. And about 22%, they might have a little bit of initially a little flaking or a little redness, which is easily addressed just by saying, okay, well, why don't you start off every other night? And it's taken care of. So we also have peptides, we have anti-inflammatories. In duality, in that retinoid chamber, we have an ingredient that gets rid of discoloration 300 times faster. We have another ingredient that helps to block the hormonal interaction between 5A reductase and testosterone sensitivity, which has to do with this acne here, which we can talk more about. And we have anti-inflammatories. And so it is, when you put these two together with the benzoyl peroxide and the retinol, it's the anti-aging, and just the benefits are really extraordinary. I mean, it's a phenomenal product. It's,
It's incredible. I mean, I, of course, when used with the skincare management system, you don't use it on its own. Every client that has said I'm really sensitive, I put it on, like, and their acclimation period is nowhere near what they would have
yeah,
expected it to. You're not easy and inflamed, and a pattern that I have seen with more of like the prescription strength is they'll say, "Oh, I use it 1 to 2 times a week," and I'm like, "But are you really getting?" You know what I mean?
exactly.
Got to do it daily, just like the gym. You know what I mean? If you want the to see the results, it needs to be consistent. So I could hear you talk about just duality all day.
But it really is. I mean, people are so used to having those kinds of products dry the skin. There's this acclimation, you look worse, and it just doesn't happen. I mean,
Incredible.
yeah, it really, and you're actually getting, well, let me just say this. In the clinical study, this was done with dermatologists. One of the female derms said, I will never again prescribe a prescription retinoid to a patient unless they beg for it because this works so much better.
Wow.
That really says it all.
It really does. And I mean, just you touching on, yeah, you're targeting acne, but you're also getting like the anti-aging benefits. Like my skin has looked better at 27 than it did when I was like 21, 22. And I feel so grateful. And it's all because of the products. They work, they're enjoyable to use. It is my favorite. Everyone's on it.
So it's really, you're absolutely right. It's progressive over time. And sometimes we don't even notice because we look at ourselves in the mirror every day and we don't realize over a year, 2 years, or 5 years. But one of the things that I do is I keep old driver's license pictures. Now, in California, in the last few years, they take your old driver's license away from you. At least they snatch it away. I don't know if I can get it back or not. But I have driver's license pictures going back to when I was in my 30s, when I was in my late 20s. And I will tell you, I'm going to be 73 in December. My skin is much better now than it was then.
So good.
And
Incredible.
we don't realize how much we can actually stop what we consider to be inevitable aging by being able to reverse a lot of the appearance of what happens with sun exposure. And it's really about solutions. I always say you shouldn't put something on your skin unless you're looking, it's going to provide a specific solution. And you really have to ask yourself, if there was something I could change or improve about my skin, what would it be? Now we're talking about acne. But if I say to somebody, well, what else would you like to change or improve? They're probably going to say, well, gee, I have some fine lines. I have some brown discoloration. Or I wish my pores were smaller. So it's about addressing every one of those concerns. Think about how you'd feel about your skin if you didn't have those concerns.
No, exactly. Exactly. But so jumping back into, because I know a majority of my clients, there are like the middle-aged women that do get the breakouts along the jawline, along the neck. What are your thoughts? The hormonal.
Okay, so that's something that's very persistent with adult females, and lots of times they'll say to you, well, when I was a teenager, I broke out on my forehead, or I broke out here, but I didn't get the nodules and mini cysts, Or I didn't even have acne as a teenager. And this started when I was in my 20s or whatever. Okay, so here's what's going on. And this is a very high percentage, maybe as much as 95% of females that tend to have this persistent breakout. It will fail antibiotics. It'll get better, it'll get worse. It'll fail Accutane. So in your follicle, you have certain enzymes, isozyme type 1 and isozyme type 2, known collectively as 5A reductase. So you have them in your skin follicles, you have them up here in your hair. So any place you have a follicle. Now, they're harmless. Outside your follicle, you have hormones. You have estrogen, progesterone, you have testosterone. We women have a lot of testosterone, but it's bound by protein. So it's like having a sack around it. We don't get, a big hairy beard. We don't get a deep voice. We don't get a hairy chest. But you can have a little bit of a testosterone sensitivity. You can be producing a little free testosterone. It's not going to show up in a blood test because there's a wide range of normal, not unless you've got a lot going on, and that would be like polycystic ovary syndrome. So if just a little bit, and what's happening is that it gets together, shakes hands with the enzymes in the follicle. As soon as they shake hands, they produce dihydrotestosterone, instant acne. It's the most aggressive form of testosterone. Now, there's some other things having to do with diet that contribute to this and lifestyle that we can get into. But we have something in duality that helps to block that. Those two helps to lessen their shaking hands and producing dihydrotestosterone. Now, I'll also mention one other thing that people can do. Keep this in the back pocket. This is like kind of a, if you have to go to the last resort. And it does not negate using the system and using duality. But that is something, there's something that can put up a wall that keeps these two from shaking hands in a certain small percentage of people that just are very resistant. And believe it or not, it's a diuretic. It's a prescription diuretic. It's been around like 60 years. It's called spironolactone. I'm going to spell it for everybody. S as in Sam, P as in Peter, Ironolactone, spironolactone. Okay, that's a diuretic that's really not even used much anymore because there are actually better diuretics for high blood pressure and congestive heart failure. This one has a unique property. And it's used in very low dose. So we're talking about maybe only 50 or 25 milligrams a day to 150, typically at the most. And what it does is it simply puts a wall up where those two can't get together and shake hands. And it can be an absolute miracle for those people that are very stubborn. Now, you still have cells sticking together, you still have all the other issues. But so you need to use the system, you need to use duality. But the other thing it does is it will lessen oil about 60 to 80%. Now, it doesn't mean it dries your skin out. It just is, how many people do you hear them tell you, Olivia, it's like my T-zone's oilier than it was when I was a teenager. So it has an interesting effect in being able to decrease hair on the face, increase hair up here.
Interesting. That.
So because what happens here is when you have this interaction, you produce more hair. When you have this interaction with the testosterone here, what happens is it exacerbates or can be a causative factor of female pattern baldness, which will happen to 50% of all women. And so it's not like male baldness, but it's where you have diffuse thinning, you have hair miniaturization. The hair doesn't have the resiliency. Some people notice that their temples recede, or they have, their part widens, or they're just like, why isn't my hair as lush? Why isn't it as, as full and as lush as it once was? So yeah, it does all of that.
That's so bad. I didn't know that about spironolactone. That's bad. But so I guess with like more of the hormone side, I know we spoke earlier, and I want to touch on it. Dairy, certain foods can
Yeah.
exactly
Okay.
inflammation.
I'll talk about two things that have to do with diet. Now, one is dairy. We know, this is a fact, we know that dairy is a causative or an exacerbating factor in acne. The study was done on 47,000 nurses. It was repeated on their sons and daughters. Then there were also two separate groups of 3,000 teenage girls and 3,000 teenage boys. And this study was published in the most technical journal, dermatology journal. It's called the Mosby Blue Book. So it's absolutely correct that it causes acne. And it's not because we give hormones to cattle, it's because we milk them when they're pregnant. And what happens when they're pregnant is they start producing steroidal hormones. If a cow is in the wild and it becomes pregnant, it will push the calf away. It will not allow a calf to nurse. That's it, done. So we milk cows when they're pregnant. Doesn't matter if you buy your milk at Whole Foods or you buy it at Safeway. It doesn't matter whether it's organic. And think about this. This is not just milk, it's ice cream. It's dairy in general. And one of the worst components is whey protein. So non-fat milk, for example, has a lot of whey protein in it. The reason why is because without it, it looks real watery. So they kind of beef it up. The whey protein is concentrated. It has more of those steroidal components. And if you're doing protein drinks with whey protein, you need to do collagen or pea protein or something else. If you're doing protein bars, whey protein is in so many things, you have to look at the labels. So that's a big factor. Now, the second part of this with regard to diet is going to be the glycemic load. So you ingest food and your liver has an enzyme that converts it to glucose, or at least to some extent, depending on the food. Now, that glucose is going to attach itself to every single cell in your body. It's very inflammatory. It will attach itself to your collagen. It will cause your collagen to break down. It will cause your collagen to harden and fibrose. It'll break down a lot faster. And it's so inflammatory that there was a 40-year study done on just women, 40 years. Number one cause of heart disease in women, which is way beyond breast cancer, is sugar. So here's what sugar does in terms of wreaking havoc on your skin besides just aging it. So the glycemic load is different than the glycemic index. The glycemic index is really obvious. You look at a candy bar, you say, guys, it's got a lot of sugar in it. But the glycemic load can be deceiving because you could have, the analogy I love to use is a piece of whole wheat bread and a quarter cup of sugar. The whole wheat bread will turn into more sugar when you ingest it than the quarter cup of sugar. So it has to do with carbs. Carbs turn into sugar. And they can be worse than even just eating sugar. So what happens is that when your insulin levels are spiking all the time, they're not nice and level. Give you an example. You go out and you have a nice pasta dinner. You have some garlic bread and then you have a nice dessert. Your insulin levels are going to skyrocket. So they're going like this. Your body, in order to take the insulin level down to a level that's more even, produces testosterone to do that.
That makes so much sense. Not the ice cream. It's like,
I
what?
know, and I'm going to tell you, you're looking at the biggest sugarholic there is. I couldn't be any more addicted to sugar.
I,
I went with it. It was not easy. I hate it when people say, "Oh yeah, I went off sugar. It was no big deal." No, it was horrible to go off of sugar. But also, I eat in a very insulin level manner, and that's going to be protein. You need more protein as you get older anyway, but it's protein, whatever your protein source is. Personally, I do fish, I do chicken, I happen to like meat, I eat from head to toe, so I'm the heart, the brain, I mean,
yep.
all of it. And so whatever your protein source is, and fruit and leafy green vegetables and things like that, things that are going to keep your insulin levels very stable. And I will tell you, you will notice a difference in your skin. It's not going to make your acne go away overnight, but over time, in terms of just how your skin ages, that one component, as well as just how it has much less of an inflammatory effect, and you notice that your acne really does calm down a lot. It's all of that together.
Yeah, it's everything into play. Like not only like when I eat a really clean diet and more like red meat, fruits, vegetables, I feel better. So when I feel better, I look better, and it just like comes into play. But the minute I get on the sugar train, it's like downhill from there. I have to like cut it out completely. So
I understand exactly. And somebody asked, what moisturizer would you follow up with Duality? So first of all, you're going to be using the skincare management system. That is a cleanser, a sunscreen, 3 products in between. Your moisturizer is in there. It's Transformation, if you're normal combo in that range. And it's an extraordinary product. So that it comes with directions and exactly how to use everything, but you're going to put on your BioClear, or excuse me, your Duality after your BioClear, which is number 3, and before your moisturizer, which is number 4. The products are numbered. We call that 3.5. 3.5 is kind of the nickname we've given for that space in between those 2 products where accelerators go. Duality is an accelerator. Luminate, for which has a retinoid in it for brown discoloration, or Rosalieve, or any of these things, or other accelerators we have, that's where they go. That's the space that they go in. But you don't have to worry about your moisturizer because it's in the system.
all numbered. It just makes life so much easier
Yep.
as well. I know we have about 10 minutes left, so I just want to make sure we get everyone's questions in. If you have questions, go ahead and send some messages. I know we spoke about Duality is great for like the acne, scarring, pigmentation. Luminate.
Okay. I notice on here too, there's a question, what should I recommend to a client who struggles with a dilated pore of, I think it's referred to as dilated pore of Wiener. So those typically, if you've ever watched Dr. Pimple Popper, for example, those they have to get extracted and removed. Typically, just squeezing them, if you can get something out, is not going to control it, because if you watch when they do the surgery, what they do is they have to get in, not only do they have to express all of that material in there, but they also have to remove the sac. So there's a little sac in there, and if you squeeze something out, it just fills back up again. So it has to be completely removed. You need to get them to a good dermatologist.
That's really good to know. I have someone here had asked, in the skincare management system, why do you apply the BioClear after siesta?
So Siesta is a really unique product for a number of reasons. It's a lipid-soluble form of vitamin C. We don't have time to go into a lot of detail, and it has something in it called dimethylaminoethanol, DMAE, which causes muscle shortening at the neuromuscular junction, causes the appearance of skin to pull up. It's also one of the most powerful anti-inflammatories we've ever found, and it's a delivery agent. When we put Siesta on first, we actually can get things into the skin, in my opinion, as a formulator, that we normally wouldn't be able to get this result. And so it's just a methodology for being able to get the best penetration, uptake, and the best overall effect.
And then we've got, which of your resurfacing products are safe for higher Fitzpatrick's?
All of them,
Every single one of
every
them safe.
one of them.
Incredible.
Yeah, there's nothing in those products. In fact, they're going to make the skin look a lot brighter, help with a lot of issues that sometimes a lot of pigmented skin deals with, which could be ashiness or just some types of discoloration that can affect more pigmented skin. When you get leftover acne pigmentation or pigmentation from a cut or an abrasion or inflammation, in darker skin, it can be purplish, brownish, even blackish. So we can actually address all of that.
gentle enough. Okay, maybe one more question, and
Sure.
I think this is a great way to. So I'm currently breastfeeding. What can I use to clear up my occasional breakouts and brighten post scarring?
Okay. So first of all, keep in mind that you need to do something all the time, because what we want to do is we want to prevent you from ever breaking out. Once you break out, it's the end of the process. Nothing you can do really, very little you can do with a breakout because it's already gone through the process. So here's what is we know is safe for breastfeeding. Now I'm going to preface this by saying, if you were to call our technical support department and you were to say, I'm pregnant or I'm breastfeeding, can I use water? Our answer would be, ask your doctor. So you should always run this past your physician. But there's nothing that's contraindicated in the skincare management system. There's nothing that is contraindicated with benzoyl peroxide. Now, we sell benzoyl peroxide separately, the same benzoyl peroxide, and we sell it in a 2.5, or excuse me, I'm sorry, a 5% and a 10% leave-on. Okay? The wash, benzoyl peroxide wash, not for adults, 5% leave-on, so you can use that with the system. Now, chances are your doctor will say it's fine to use retinol, even though you're nursing or that you are pregnant, but you need to ask your doctor. Why doctors say no prescription retinoid when there's very little evidence of any absorption or that it's going to have a negative effect, and why they say retinol is okay when it converts into retinoic acid, I don't know, but your physician has the last word on that.
Absolutely. Absolutely. And before it closes out, something to mention that you said is like what you're seeing on the surface is the end of the process. So
That's right.
spot treating, you always want to treat the entire face. We don't have a magic ball. We can't detect when.
Thank you. You,
So
we're not psychic.
no,
You know, I broke out here, I'm going to treat that. Well, we're not psychic. We don't know when the next breakout's going to be.
exactly.
You you treat you treat you know, if you're very fortunate, and let's just say occasionally you run across somebody and they have really clear skin, except they always break out in this area. This is it. This is the only area they break out in. Okay. Well, then I might say, use your program, get your benzoyl peroxide, 5 or 10%, put it on over the top of the other products, and don't put it anyplace else. But that's generally not the case.
It's so important to remember that, so it's always, we can never detect where the next one's going to pop up.
That's
So,
right.
and thank you so much. It is
You're so welcome.
fun to just sit and talk with you. I could listen
Yeah.
to you for hours. It was just like,
You're so kind. Thank you. And I loved all the questions. Thank you, everybody. And I wouldn't be here without you. And by the way, is it safe to use, I got to answer, is it safe to use retinol and siesta in the same application? Absolutely. Ascorbic acid is different. There's something called reduction oxidation, and the ascorbic acid will reduce the retinoid. They're not compatible. It is compatible with siesta, which is L-ascorbic acid 6 palmitate. It's not ascorbic acid, it's ascorbyl palmitate. It's more bioavailable. It works better. Wish we had time to go into that. Great question, but I don't. So
any more questions, please feel free to send me a message. We're always here to help with any questions that you have. Jane, I hope you have a great rest of your week. It's always so good to talk to you.
It's a pleasure. Thank you so much. And I can't wait till we get to do this again.
Yes, absolutely. Absolutely. All right. You have a great week, and I will talk.
You too.
Bye.
Bye.